Here's a speech from Mindy Avery, and here is her audience. Okay.
Hi, I am Mindy Avery, and this speech is for my Introduction to Speech class. The purpose of this is to present a persuasive argument or speech. Today I'm going to talk about obesity, not so much the trend or the prevalence of obesity in America, because I think we would all agree that it's very common and it's being addressed from many different angles. Today I'm going to talk about obesity from the angle of nursing. We see patients, whether in the doctor's office, at a well exam, or in the hospital, any number of places, and a lot of these patients, or some of them, are overweight or obese. And as nurses, we know that being overweight and obese can lead to other problems, such as coronary heart disease, type 2 diabetes, breathing problems, aches and pains, and not even touching on the depression or the self-esteem issues or the criticism that they receive from a discriminatory society. One of the things that I have found is that it's a subject that is very scary to talk to someone about. It's not an easy thing to talk to someone about, and it's easy to hurt somebody's feelings. As professionals, I feel like that we have the power to do this and to help these patients before they develop some of the diseases that I listed. I actually read an article written by, I believe his name was Dan Kent, in a Population Health Management journal, and the entire article was about type 2 diabetes. It was about the progression, blood glucose checks, insulin, people that lose toes and feet and develop so many other problems due to type 2. However, after reading it twice, I never found anywhere in there that he addressed how these patients can go into remission, which is lifestyle changes. It's nutrition, it's exercise, weight management, things that can improve our patients' lives, which is what we are here for. We are our patients' number one advocate, and our goal as nurses is to not only treat the conditions that they have, but also improve their quality of life. Even as nurses, even as professionals, you run into the issue of non-compliant patients. A lot of times patients feel like their weight is genetic and there's absolutely nothing they can do about it. Whether this is true or not is up for debate, but the problem is that even if it is genetic, you can alter your genetics. You can change your lifestyle to where maybe you can't have the same diet or the same sedentary lifestyle as a friend who can eat 18 hamburgers a day and never gain a pound. If you're born with these, a slower metabolism or hypothyroidism or any other issue that can fluctuate with your weight, there are ways to keep it under control. And I feel like as nurses, this is very important for us to teach our patients, and we're not. A lot of times we see these patients at anywhere from 10 to 20 years old, and we never address the issue until they're 23, and we're talking to them about type 2 diabetes, when the real intervention should begin as the problem starts. I think the most important thing as nurses that we need to remember is that we can't be scared to talk to these patients, and you have to be sympathetic because it's a very hard pill to swallow. It is something that will be difficult for your patient to accept. But by being scared and not talking to our patients about this, we are allowing this disease process. And that's not our job. That's not what we're here for. So that's my speech for today. Thank you for being here.